And welcome back. Well, many people who have pain use medication and physical therapy for relief, and if that doesn't work, you might try cortisone shots or surgery. But our next guest says those solutions don't treat the cause of the pain. Dr. Neal Pollack is a board-certified neurologist and musculoskeletal pain specialist, and is also the area's leading expert in prolotherapy, which I'm excited to chat about. Thanks for being here.
You're welcome.
I think this is fascinating. You and I were chatting during the break about kind of how the traditional, how it goes. You get anti-inflammatory medicine, you get PT, you get cortisone shots, and if all those things don't work, it leads down to surgery. This is a way you say you can potentially avoid doing all that because these are not treating the cause of the pain, correct?
That's true. The cause is weakness of the supporting tissues. That leads to different changes in the muscular responses and eventually the joints. If you can treat those things, a lot of times you can avoid surgery.
So those are, you're talking about ligaments, tendons, things like that that need to be strengthened or worked with.
Yes.
So how do you do that? Because here's the thing. A lot of people with chronic pain in their body and in their spine, they don't feel like they ever heal. They're not ever getting any better. So they really feel desperate.
That is very true, and a lot of times they don't heal because they are treated with classical treatments that don't allow healing to occur. These ligaments, these tendons, they're tissues that don't get the same blood supply that other tissues get. You need to treat them in other ways by giving them anti-inflammatories, by giving them cortisone. It does not address the main problem, and it actually weakens them.
I've heard that. I remember I was telling you I had shoulder surgery, and they were saying even with cortisone shots, you're going to, injure eventually that good tissue in there, and that's what it really does.
That's very true.
And so, they'll tell you that up front, and it's not necessarily the best thing to do. So let's talk what prolotherapy is, because this is a way to potentially avoid all those things but get rid of the pain.
Prolotherapy is a type of regenerative therapy. Now, there are several of these. Prolotherapy being the most affordable type. Maybe you've heard of stem cells, maybe you've heard of blood interjections. This is a type of natural solution injection treatment. Let's talk about the shoulder. You treat the ligaments that support this, you go into many different areas and you stabilize, you strengthen, you fortify, you proliferate and build up.
So by doing that, it's going to what? Make the joint stronger?
It's going to strengthen. It's going to enable you to train some of the outside tissues like the muscles, which a lot of times react like this to the trouble, and enable you to get your function back without these very advanced treatments, the surgical treatments, which sometimes leave you with scar tissue and difficulties afterwards.
Absolutely. Amen. Who's your ideal patient? When you're talking about, we obviously referred to my shoulder, but other types of joints and things, who is a good candidate for something like this?
A candidate for these treatments is anybody who has localized pain, who has been told, who hasn't responded to treatment, and who has been told, well, you may need surgery.
So it's okay if you've tried some of the traditional things, the PT,
it is, and frequently
the cortisone.
That's the patient who comes in. I'm not responding. I heard about this. Can you help build this up and regenerate this? Can
you do it after surgery as well, if you're still not getting better?
Yes.
Okay.
It doesn't work as well.
That's good to know.
But it is helpful for some of the scar tissue and some of the responses that occur in reaction to the surgery.
So what would a typical appointment be? Someone's heard about it, like you said. They maybe have not had response, or they don't want to have surgery. They don't want to have another cortisone injection. What would it be like to meet with you?
The first thing to do is come in and be evaluated. In order to determine what treatment is needed, a thorough examination has to be done. And this includes a history, it includes palpation of these different areas, because there are many ligaments, many tendon connections. So you have to know your anatomy. Number two, you have to know your patient, what else is going on. So when you get all that information, then you can form a plan.
Does it hurt? I think about injections, like a cortisone shot, and they're tolerable, but they're not pleasant.
This is an office procedure. And various areas are marked. Various areas are then sprayed with a solution that frees it up.
Numb you.
So it's done in the office. They walk in, they walk out.
Yeah.
And usually they walk out feeling better because there's some numbing medicine that is given. With time, that wears off. This has to regenerate and proliferate. So there's a process, and they usually need several of these treatments.
How long will you feel results? Because you're saying you need a couple treatments, but when will you start feeling a little bit of relief?
Every case is different. You may feel relief initially. It may take several treatments because you have this stage of proliferation that is involved. Along with this, I teach proper biomechanics. How'd you get into the problem in the first place? You did something, you either had an injury or some movement that produced this.
Right.
So that is essential also.
I think what's important is for people to come in and meet with you, like you said, and be evaluated, find out what's really going on, get to the root of the problem, especially if you've been trying some things that are unresponsive, if you've been using conventional treatments, they're not working for you, or even if you've had surgery recommended, you're looking for something that's cost effective, is natural, and efficient treatment that's alternative. Call Dr. Neal Pollack from Neurology and Pain Treatment, and the MilwaukeePainClinic.com is the website to go to. The phone number to call for an appointment is 414-453-7780. And again, that therapy is called Prolotherapy. He can teach you more about that and how you can become pain-free too. Thanks for being here, doctor.
Thank you.
That was